Starting with the numbers, and I'm actually going to just real briefly pull up our dashboard here. So we have 2,897 confirmed cases in Milwaukee County, 168 individuals who have died. County Executive Abele pointed out, but you can see our stark differences now that we expanded this upward a little bit in the cases here. And then I just wanted to point this out and pull it up to show a few new items, that I think will be helpful for our public, our decision makers. One is this 14 and 7 day map. So you can now see more accurately what's going on over time, what's going on over the last 14 days, where the clusters are, and then just over the last week, where most of the cases are. And it has all the same layers as we've had previously, to see demographic data, to see heat mapping, to see density per capita. The other item is testing data. We've talked about how we're ramping up our testing. So you can see our total tests performed here, a run of tests per day down here with the positives down in blue. How many tests are turned around by our labs within 48 hours, and then the percentage of tests that are resulting positive. Obviously, we hope this number continues to trend downward. So this is some more data, some more numbers to inform everybody. And then I think it is worth mentioning as well, I appreciate County Executive Abele mentioning the quick turnaround time, but that is very little to do with me and a lot to do with the Office of Emergency Medicine, data management, and mapping team, Shannon and Zach to be specific. So definitely credit to them as well. A lot of work that goes into that dashboard. So speaking of the dashboard, when we initially developed the dashboard, our aims were just that, to provide transparency and information to the public, while also enabling our stakeholders to have a unified understanding of COVID-19's effect on our community and better determine resource allocation. When we created the dashboard, the county executive made it very clear that he wanted race and ethnicity information for our cases and our deaths to not be hidden under tabs and layers, but to be immediately visible and immediately understandable to both the general public and decision makers alike. And this is not, I don't want to put words in his mouth, but this is not because we're proud of the lack of disparities in our community, but on the contrary, it's because we're working to view COVID-19 and view our interventions and our messaging through a lens of racial equity. And it's because of this data that we know that an African-American person in Milwaukee County is more than 3 times as likely to die from COVID-19 as a white person in our county. And while COVID-19 starkly outlines the racial differences in our community due to the visibility and the near real-time spread of a pandemic, these disparities are not new. We see them in heart disease. We see them in stroke, in cancer, infant mortality, and overall life expectancy, along with many other health measures. We see this on a community level in large part due to, as has been discussed, the historical, the institutional, and the ongoing effects of marginalization and racism in our community and in our county. So this racial equity ordinance emphasizes and I think integrates into high-level decision-making the importance of this lens on racial equity and the transparency that we seek with the challenges and the disparities in our community. Thank you very much and stay safe.
Thanks, Dr. Weston. And now we'll hear a report from our public health officer, Ann Christensen, who's the director of the North Shore Health Department and the health officer there. Director Christensen. And you're muted, Director Christensen, at the moment. There you go.
Great. Yeah, thank you. Thank you for the opportunity to be here today, most importantly for this important message for everybody. As noted, I represent the 11 health departments in Milwaukee County and have the privilege of putting the public health perspective on COVID-19 as well as today's comments. I do want to just talk more generally about the progress that we keep seeing in terms of our day-to-day work on COVID-19. Just in the last 24 hours, we received results from 44 different cases who were positive. That compares to 9 days ago where we saw results from 98 people. So again, the trend that we're seeing is demonstrating progress, especially with the stay safe at home order in place. And we're really thankful to the community for all your work in making a difference with heeding the order to stay safe at home. I wanted to talk today about some of the public health measures that have been voiced in the media, as well as where we're going in our next steps with what we're going to be focusing on. And I think that there's been a lot of talk of contact tracing. And what does that mean and what is that? And I feel like it's important to bring that up today, especially because contact tracing is an investigative process, number one, but it is also a window into the stories and lives of the people that are impacted by COVID. And public health really has the privilege of working with people for the course of an isolation period or quarantine to help them really navigate the concerns, the fears, and the conditions of which they're living under, either having COVID or being exposed. So it's really a great privilege for us to work with community members in this capacity. So as you hear about it, again, it's talked about in terms of a scientific tool, but again, it's also a tool that really is a privilege for us. And we hear the stories of people that struggle with being in circumstances where this impact that they're having, be it an isolation period where we're asking them to stay home for 7 to 14 days, that's really challenging for many people. And our role is to work with their employers, their families, whatever social supports they need to try to help them in that time where they are struggling either emotionally, financially, or just socially to really be in a place where they're safe and supported. So we are with people in this time as this contact tracing process, and recognize that, again, that's quite a privilege for us. Just wanting to talk a little bit about it, again, to sort of dispel any myths about what contact tracing means, and to really help people understand as we scale up our work in this, that it takes a tremendous amount of resources from public health. And we're talking about scaling up staff in the local health departments to be able to have enough resources to basically identify and track all of the individuals who test positive for COVID, but then all of those people that are within the vicinity of that person who may be exposed. So that's a tremendous amount of human resources to do that work. Early on, when we didn't have Stay Safe at Home in place, our health department, as well as others, were tracking down hundreds of people that may have been in contact with a single case. That was a tremendous amount of work. Because orders like Stay Safe at Home and movement restrictions are in place, really our contact lists are very small right now. They're really minimal to household contacts. And you see that with the data that we're sharing, that those decreases in the people exposed are having direct impacts on the reduction in our cases. So that is a very good thing. It is why we've got this order in place, and why the governor talks about dialing it up slowly so that we don't all of a sudden expand those contacts again to be in the hundreds, because that's just too many. We wouldn't be able to control the spread if we continue to have that many contacts. So I have a request of the public in terms of this process to help us navigate the next steps. One, very importantly, is if you're sick, stay home. So don't go out in public. It's really important that this advice be heard, because again, if you're in public while you're sick, everybody in your vicinity becomes that contact person that then local health has to follow up with and notify that they've been exposed. So if you proactively stay home while you're not feeling well, that list is very small for us. So that's one very basic ask that we have of everybody in the community. The second is if you're tested, there's two things. One is if you're tested, stay home until that test result comes in. Again, don't be in the community, because if you test positive, that whole time we have to find everybody that you've been in contact with. Again, a tremendous amount of work. And then just in terms of making sure your doctor has your address and a way that we can reach you. There's a lot of resources that go into tracking people down. So just make sure when you get that test done that that information is current and available. Again, it does make it easier. We're very much going to be able to meet that notifying contacts within 48-hour goal, which is what we have set out there with that general information. So I know that sounds like it's you'd be surprised that that information is not available. It sounds like it should be, but just that's important for people. So again, the process is very straightforward from our end, but with these little things that we can do, we can all stay safe, and making our work helpful for you in this time, both if you're identified as a case as well as if you're a contact. And again, just to remind you that health departments are here to support you in this time. We recognize that this is scary for some, but we are here to help and support and provide you with resources and information that you need while you're either sick or in quarantine. So that's my public health message today.